Hi, everybody. Welcome to the last week of Chronic Adult Health. You've made it, so be glad in that. And this week, for the last sidebar conversation, hopefully you've enjoyed them, we talked about palliative care and some more geriatric assessment material. But I want to focus a little bit more on the palliative care aspect. I know I go over a lot of it in the lectures, but still, it's worth a little bit of a deeper discussion. So, as you all know, I work in long-term care, so palliative care is sometimes a part of that, towards the end of life, or even just when a person decides that, they don't want to have any more curative treatments. They just want to live a comfortable life. Um, and I help accomplish that. So, there can be advanced directives such as, do not hospitalize, maybe only give IV hydration for comfort measures, um, you know, uh, no IV antibiotics if they don't want it. So those can kind of even sometimes be palliative measures, as opposed to hospice care, which is really at the end of life. Um, Ideally, this is kind of where advanced care planning comes into play. So, as you're seeing patients, whether you are working in family practice or you work in long term care or wherever, you're having these conversations with your patient and their family about what their wishes are so that when it comes to the point where there is significant decline, you can keep opening that conversation and use that as a stepping stone to maybe discussing palliative care or hospice. They are great services, and I feel and I've seen in practice, and sometimes we wait until it's too close to the end. We'll initiate hospice care when somebody is actively dying, and that's really not the point of it. Same thing with palliative care. Maybe someone is living with cancer and they still might have another year or 2 years to live, but they just don't want to have any more curative treatments, go through chemo, radiation, and, surgical procedures, whatever. So maybe that's a good discussion for them to, talk about palliative care. So just don't wait until it's, not that it's too late. It's never really truly too late to try and make somebody comfortable, at the end of life. But, the services, there's wonderfully trained hospice nurse practitioners, palliative nurse practitioners, physicians, that can really be involved early on or earlier on in the plan of care, and help coordinate services, with like social services if they want to, be at home, or pain management is always a big one. Pastoral care, so maybe involving clergy in whatever their particular religion is or spiritual needs are. So, it's a difficult conversation, but necessary sometimes. We don't ever want to usually talk about, well, somebody is dying or there's nothing much more that we can do to help them, but we can always make somebody comfortable. So, even what I do, I'm a per diem role. I'm there once a week and I see my patients. But sometimes it's worth just having a phone call with, family members in my case, depending on the patient's circumstances, and saying, I've noticed a decline. I just wanted to go over their plan of care. These are their current wishes. Maybe they're a full code, or maybe they're a do not hospitalize DNR, or whatever it may be. And I think it's worth just clarifying and maybe discussing some further options. So, you don't always get an answer right away. You don't usually expect in one visit, in one phone call to, um, you know, change somebody's mind and have them go to palliative care or hospice. Sometimes it takes a couple conversations, and that's okay. But I just wanted to emphasize how great those resources are, how you as a nurse practitioner can go about, putting the referral in and going down that road. And it's just having open, honest conversations as frequently as you need to, and, helping the patient get the care that they need, that they deserve, and to keep them comfortable. So that's my last sidebar. Hope you've enjoyed these little side tracks in my mind and you found them useful. We'll see. But otherwise, great job in this course. Like I said, you've made it. You're almost done. So good luck to everybody on the final, and take care, everybody.